How does birth control affect a woman's body based on the contraceptive? Well, there are two very common methods such as a pill, and IUD. Birth control pills are a medication that is used to prevent pregnancy and contain hormones that overthrow ovulation, which is done so by the combination pill, containing estrogen and progesterone. A menstrual cycle is an event that is important to a woman's body in order to reproduce. These monthly events occur when the woman's body is preparing for a possible pregnancy. Each month an egg is released from the ovaries, which are called ovulation. The egg travels from the ovary through the fallopian tube into the uterus. During this process, the lining of the uterus, called the endometrium, starts to thicken, allowing the egg to be fertilized. If the egg is not fertilized, this is where the bleeding takes place from a woman's period. The lining of the uterus shed blood and the cycle begins again. Hormones within the brain play a role when they are secreted by the hypothalamus, pituitary gland, and ovaries. Each of these three secrete a specific hormone. The hypothalamus secretes the GnRH hormone, then carries it through to the pituitary gland that secretes FSH and LH, and passes to the ovaries that secrete the estrogen and progesterone hormones. These four hormones work together as a network from the first day of a woman's cycle to the 14th day of ovulation, to the 28th day, the last day of the cycle. The FSH hormone is important at the start of the cycle to help produce mature eggs. LH is important for releasing the egg from the ovary. As for the other two, estrogens and progesterone show high levels after ovulation and prevent the other two hormones from releasing eggs. The combination pills act as a mimic of the hormonal state, which tricks the ovaries into thinking ovulation has already occurred. This makes the FSH and LH levels stay suppressed and no eggs are matured or released when on this contraceptive. The combination pill has 3 rows of blue pills followed by a row of white pills. The hormones for the 3 weeks of blue pills stay constant until that last week because the estrogen and progesterone levels fall. The white pills are called placebos and cause a woman to have fake bleeding that week. This indicates that fertilization didn't happen. Women that are not trying to prevent pregnancy and are on the pill, due to other menstrual issues, take extended cycle pills and have their period every 3 months. Some women can't tolerate estrogen, so they take progestin-only pills, also known as mini pills. These pills don't do a great job of preventing ovulation as combination pills do. This contraceptive thickens the cervical mucus, trying to prevent sperm from entering the uterus. Combination pills are the most common contraceptives along with IUDs. There are 2 types of IUDs, copper or hormonal. They are both placed within the uterus but have 2 different functions. The copper IUD does not contain any hormones and affects sperm mobility and egg survival, and therefore the sperm does not like copper. As for the hormonal IUD, it contains progesterone that is released. Hormonal IUDs also ease a woman's period and make the uterus feel comfortable. There are several birth control methods that give women an option to prevent pregnancy.